So good evening. Today in the learning series we will start the topic of psychiatry, which is being learned least but has a simple understanding for the MCQs, and we just learn it by the simple MCQ. And the first MCQ we had is the most accurate treatment of the erectile dysfunction is. The most accurate treatment for the erectile dysfunction is the ideally so anybody so the most accurate treatment is basically the nobody it is basically the tablet sildenafil, which is a 5-phosphodiesterase inhibitor drug. Very good. Yes, Dr. Sarojini, that's also true. Yes, very good. So ideally the answer should be the A and B. But if somebody asks you the most accurate treatment, the medicine will take up the issue. Squeeze technique is basically, Dr. Saab, squeeze technique is used for the premature ejaculation. Squeeze technique, Siemens technique is used for the premature ejaculation. So basically, we know that we just do the questions. So squeeze technique is basically used for it's basically for the premature ejaculation. Monday disease of the heart and low BP. Yeah, sildenafil is notorious for that. So we have the other drug like tadalafil and vardenafil, which are not having such side effect. But the treatment of the erectile dysfunction is the sildenafil. Yes, we can also go for as Dr. Imadi has said, that we have to go for the dual sex therapy or the couple therapy by the Masters and Johnson's technique. Okay, but the answer would be sildenafil for the erectile dysfunction. Okay. We know erectile dysfunction is a disorder of the which phase? A, the desire phase, the excitement phase, the orgasmic phase, or the resolution phase. Badai Dr. Saab. Is a disorder of. That's also an MCQ. So it is a disorder of the orgasm. Dr. Imadi Sarojini has said. थोड़ा बेसिक हमारा गड़बड़ है डॉक्टर साहब तो. It's a disorder of the excitement. For the orgasm, we have disorder. Welcome, Dr. Gandaful. So very, very interesting MCQs you done right, all right, but yesterday. But erectile dysfunction is a disorder of the excitement. So erectile dysfunction and lack of lubrication in female is a disorder of the excitement phase. Orgasmic phase is the premature ejaculation, and in females it is anorgasmia. So these are the simple lollipop question we have. in the psychiatry, that the, yeah, that's what we are done. So desire is basically, so let us do the explanation. So I think it is clear. The desire, excitement, orgasm and the resolution. In the resolution we don't have much. So let's find the fill page. Desire is that I don't have desire or I have a lack of desire. So we know it could be a hypoactive sexual desire, or it could be a sexual aversion disorder. But we know as per DSM-5 this is no more available. So we only have the hypoactive sexual desire, that the person does not have the desire to be indulged in the sexual act. Okay. Then in the excitement phase, we know what happens, the erection happens, the, in the females there is a lubrication happens, there is engorgement of the nipples, the pulse, blood pressure rises and sweating happens. So that is all the excitement stage. So in this there is a lack of the lubrication in female, and in the males it's basically the erectile dysfunction. So that is the simple. In the resolution we don't have much of a disorder. In the orgasmic phase, as I told you, the orgasm is characterized by the feeling of the completion or the ejaculation. So we have the, in the male we have PME, and in the female we have the anorgasmy. In the resolution phase we may have the either we have post-coital headache or post-coital dysphoria. Okay. ठीक है डॉक्टर साहब. So these are the stages and these are the treatment. But before we go to the stages, I think desire can be also, desire can be excessive desire also. We know excessive desire is also, we have an MCQ, we just learn the MCQ there only. Now that is about the question that talks about the gender identity disorder, correctly being called as the transsexualism, but in DSM-5 it has been called as the gender dysphoric disorder. Gender dysphoric disorder. So there is a dysphoria to I am dysphoric about my gender. I believe that I should be a female, or I am actually a female trapped in a male body. That is nothing but the gender dysphoria. ठीक है डॉक्टर साहब. So attractive, well-dressed woman is a test for this, and he found to be actually male, and so on. We know the next question is the excessive sexual desire in males is known as the satyriasis. And very good, Dr. Hemlata, Dr. Mohammed Sohail. So in the female, such desire is known as the nymphomania. So excessive sexual desire in female is known as the nymphomania. Okay. Nymphomania is basically, Dr. Nitish, is for the males. Sorry, females. For male it is a satyriasis. Okay, so we have learned hypoactive desire and the hyperactive desire. So that's not the typical disorder in the psychosexual psychiatry. Very good, Dr. Anji Reddy. Yes. Now again we have the homosexual person feeling that he is imposed by a female body and has persistent discomfort with his sex. The most likely diagnosis is, again we say, anybody persistently disturbed or discomfort with his own natural sex, it is being called as the gender identity disorder, but classically correctly been called as the transsexualism and currently been called as the gender dysphoria or gender dysphoric disorder. Okay. Transvestism is basically just wearing opposite gender clothes for fun or for time being, just to enjoy the, but no sexual pleasure in the transvestism. Okay. But the moment there is a sexual pleasure comes, I enjoy wearing the opposite gender clothes for the purpose of the sexual pleasure, it will be called as the fetishistic transvestism. So you have to be very careful because terms are quite confusing and they may be trapped. So we must know there is something in psychiatry called as the transvestism and fetishistic transvestism. Here wearing opposite gender clothes for sexual pleasure. So it is basically a type of a paraphilia. Here I wear clothes for fun or no sexual pleasure. ठीक है डॉक्टर साहब? Now, again we have so many questions about the transsexualism, and this is about the fetishistic transvestism, dual role transvestism and fetishism. So we all have the all terms. So it's a transsexualism. Okay. What is the answer? This Neelu girl is basically enjoys wearing the male gender clothes and it gives her feeling of more confidence, and after this episode of feeling more confidence, no pleasure of sex, she is absolutely normal girl. बताइए डॉक्टर साहब. So in the line and the era of the too much of the transsexualism GID disorders, answer is now A, B or C. बताइए डॉक्टर साहब. Answer is nobody. Dr. Deepa J, no. Answer is the C. It's a dual role transvestism. She is just enjoy wearing clothes. temporarily. Okay, very good, Dr. Hemlata, Dr. Vidya, Mitra, Dr. Genda Phul. It is the dual role transvestism. And we say, the question say that otherwise, after this episode, she is a absolutely normal girl. Indicating that basically, very good, Dr. Santosh Pant is also joined us. So, we have Niman's question and the Jipmer question on the Thursday at 11 p.m. special class. So that's very good. So we have to keep our calm, because sometimes we do so much of transsexualism or gender dysphoria that we may think the normal pleasure of this dual role transvestism misled for the transsexualism. So it's case of a dual role transvestism. Now, how to differentiate between the psychological and the organic erectile dysfunction? Cheap and best free test is psychological because of anxiety. So most of the 90% of the cases of the erectile dysfunction are disorder of the excitement state of the sexual cycle. Basically is a disorder of the psychological region like anxiety and depression. Very good, Dr. Genda Full. It's a Dr. Nirupama. It is A. Nocturnal Penile Tumescence test. We know, we have learned during the REM sleep there is a penile erection. During the REM sleep there is a penile erection. That's a nocturnal penile tumescence test. Okay. So sorry for some distractions. So squeeze technique is no way technique for testing. Yes, we can have a sildenafil induced erection as a next level test. First test is the nocturnal penile tumescence test. Second is the sildenafil induced erection, and so on. Now squeeze technique is used for. Now we know squeeze technique is used for the premature ejaculation. We know it's a disorder of the orgasmic phase. Disorder of the orgasmic phase of the cycle of the sexual this, and we have technique called the squeeze technique. So at the zenith of the excitement, the partner is trained to squeeze the coronal ridge. Okay, with a pressure which will take away the erection but ultimately will delay the ejaculation. Okay. Second technique here is the Siemens technique. Siemens technique is again a technique for the premature ejaculation, basically called as the stop and start technique. So whenever the person is feeling that he would be ejaculating, he will be advised or asked to stop the act, to come out of the the vagina, and then again start after some time. Again, it will take away the call on the erection, but ultimately will increase the ejaculation time. Also, the new definition by DSM-5. There are a lot of controversy. What is the ideal time? What is the for the ejaculation? DSM-5 said that any ejaculation less than 1 minute of the after the entry is the premature ejaculation. They also graded the severity of the PME based on the duration. So between 40 to 60 seconds, it is called as the mild premature ejaculation. From 30 to 40, it has been said as the moderate. 20 to 40, sorry. And less than 20 seconds is a severe premature ejaculation. So basically, the DSM-5 has gone step further to clarify all the myths, and they included the timeline, and they say anything less than 1 minute is the premature ejaculation. Mild, moderate and severe based on the duration. So that could be an MCQ, not been asked much, but just to know. Till that today they only ask you premature ejaculation is a disorder of the orgasmic phase and erectile dysfunction is the phase of the excitement phase. Again, now we have a male coming to the OPD with the erectile dysfunction. The basic screening is unremarkable. The next step in the evaluation should be, again, we would go for a simple, cheap and best test. Before the Doppler study, before referring the client to the neurological testing, and before the cavernosometry, we would give very good Dr. Gendapool. That is a wonderful. You have been doing all answers rightly. Answer is the oral sildenafil titrate trial. So we give the dose of the sildenafil and see the response. So if it is a psychological, most of time it has been taken care by the sildenafil test. Now next we have the dual sex therapy. We know in this therapy the couple is being treated. True about is that couple therapy. No drug is used. True is that, बताइए डॉक्टर साहब, it's a couple therapy. Both the partners are treated simultaneously. It does not use any sildenafil. It uses only the sensate focusing. Sensate focus. Finding out the sexually stimulating point in the partner. Making the partners comfortable with each other. Because most of the time, the reason for the excitement phase disorder is the lack of the psychological comfort. So it start with the therapy very good Dr. Hemlata, Dr. Genda full D nahi karna hai. See, it's a couple therapy for the erectile dysfunction. So there is no role of the dual gender identities. It is basically to treat the couple. In this, what has been done, that's what I am telling you. First is the sensate focus. So first of the time, the couple is being trained in the non-genital sensate focus. So just to stimulate, just to lie with the partner and touching, kissing only the non-genital part of the partner. Then after 1 week or 10 days of this practice, then they go to the genital sensate focusing. So by this therapy given by Masters and Johnsons, so it says that most of the sexual issues or the erectile dysfunction issues has been taken care by just the couple therapy of the stepwise approach of non-genital moving to the genital sensate focusing. Now that's MCQ, not of our country but of different country, because that usually doesn't happen. The scenario they are talking is quite unique, but we got a good MCQ from here, so we just do it. It's a 48-year-old man who has been not able to having a relationship with his wife for of 30 years. There is a gap of 18 years in the wife husband, and after she told that she has an affair with her partner, he otherwise have a nocturnal erection, so there is no organicity. By this penile nocturnal tumescence, we know that there is no, very good Dr. Sahab, Dr. Nirupama, Dr. Guru, it's basically a psychogenic dysfunction. So most of time we know it's a psychogenic dysfunction. And then we have a MCQ about this. See, nocturnal erections. So we have too much focused on the nocturnal penile tumescence. You remember in the sleep topic we learned there is 100 minutes total, okay, of nocturnal penile tumescence, because it will happen in the, so choose the correct statement. We know they are the normal phenomena happening in the REM sleep. They are the normal phenomena happening in the REM sleep. So first two choices have been gone. They take place in the first third of night. By our knowledge of sleep cycle, we know that REM sleep is mostly in the later part of the night. ना ना सर डॉक्टर साहब REM तो एंड में ज़्यादा होती है ना. we know we learned in the sleep cycle REM come after 90 minutes, and as night progresses REM increase in frequency and duration. So we are bound to have more REM phenomena in the later part of the sleep. So not in the first part of the sleep. Very good. But every time the cycle is been decreasing. So from 90 minutes it is now 60 minutes, it is now 40 minutes. So as night progresses, REM increase in the frequency and duration. So please understand the rule. REM phenomena like dreams, the NPT, nocturnal penile tumescence, they are bound to be in the later part of the sleep. And in the phenomena which happens in NREM sleep, like the nightmares, the sleep talking, sleepwalking, bruxism, they are bound to be in the first part of the sleep, during the first third of the night. Clear, Dr. Sir? Sorry, I've been changing the fast. So they are monitored during the polysomnographic studies. No. डॉक्टर गुरु आंसर नो 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 डॉक्टर साहब, डॉक्टर ये गलती है, देखो यही मिथ है, इसलिए सवाल कराया हमने। हमको लगता है कि डिप्रेशन में भी एनपीटी आएगा, बट साइंस से कि दो भी से साइकोजेनिक, बट साइकोजेनिक एंड ऑर्गेनिक में डिफरेंशिएट, बट it does not hold true for the depression. In depression, there is a possibility, so the true statement is that they can be decreased or absent in depression. So that's a very, very interesting question I see and I put of including in, because we all have been training you, teaching you in whole of the half an hour that cheap and best test is the Nocturnal Penile Tumescence test, and do it free of cost. Let the partner see it, let the patient himself feel it, and that's all. But this also is absent in the depression, or it is decreased in the depression. So that's a very, very interesting question. Dr. Deepa is asking, REM sleep does no, Dr. Sahab, in no REM sleep, sorry. So topic is over. So our psychosexual topic is over. I know the time may be less, though we finished on time. So I include this question. I'll answer your question, Dr. Deepa. Just wait for 5 minutes. So normal sleep cycle is basically 25 hours. Okay. थोड़ा थोड़ा फर्क है डॉक्टर साहब। डॉक्टर संतोष ने, डॉक्टर निरुपमा मैन हैज ट्राइड टू आंसर योर क्वेश्चन, and more than 24 hours is that. But Dr. Deepa, sleepwalking, sleep talking have different things. We just learn it. Okay. So we have the parasomnia. So we'll include the narcolepsy also for saving time. But Dr. Deepa has saved our time by asking this question. We have parasomnias. It is about the disorder of the quality of sleep. So we have NREM and REM. It's a very simple topic. I am taking it up, but dreams, or what you call nightmares, are disorders of REM. Narcolepsy is also one, though it's not the parasomnia, but it is also a disorder of the REM sleep. In REM we have a sleep talking, which can be in NREM 2, 3 and 4. Please note it. Please note it, Dr. Deepa. The bruxism, commonly we just teach you in REM we have night terrors, sleep talking, bruxism and so on. Bruxism happen in the stage 2 of NREM. Sleepwalking, stage 3 and 4. And night terrors, again 3 and 4. So we have to be very careful, because bruxism is in the stage 2 of NREM, sleep talking is all 2, 3, 4, but sleepwalking and night terror are only in the stage 3 and 4. If you ask me in sleepwalking, among 3 or 4 which is more, I would say again it is a sleepwalking is more in the stage 4. Okay. Done, Dr. Deepa? So we have now 2 questions to save time, because I thought the time will be less. So just do that. True about narcolepsy is all except. True about narcolepsy except. Just two questions Dr. Sahab will do. Very good, Dr. Gendaful. There is no daydreaming. Person is really asleep, but there is no daydreaming sort of a thing. Okay? No. That's a सारे आंसर गलत मत करो. Answer is A. We know narcolepsy is a pentad of the sudden sleep attack, sleep paralysis, cataplexy, hypnagogic and hypnopompic hallucination, and decrease REM latency. That means there is a REM intrusion at the beginning of sleep. So we know REM comes after 90 minutes, but here the REM will come after only 5 minutes. So there is a decreased REM latency. Clear, Dr. Pant? ठीक है डॉक्टर साहब. Dr. Santosh Pant, I think it is a decreased REM latency is the hallmark of narcolepsy, and we know narcolepsy is a disorder of the REM sleep. That's also a wonderful MCQ. Next we have that it's a disorder of the NREM or REM. So answer is the B. It's a disorder of the REM sleep regulation. So very good, you all have joined and participated in this simple topic of psychosexual psychiatry. Next we have in line is the personality disorder and neurobiology and neuropsychopharmacology MCQs from psychiatry. So true is all except. Very good, Dr. Gendaful, it's a B. So tomorrow we have personality disorder MCQ in YouTube, same time 9:30, and day after tomorrow we'll be learning the MCQs from neuropsychopharmacology and the neurobiology in the psychiatric illnesses. So this is my YouTube ID to join back. If you join the Unacademy platform, the online learning platform, providing us all the information for all the subjects, so you can get this discount by applying, and we will also get the name. So that's all. Good night, Dr. Sahab. Thank you so much all you all to join us and motivating us. All the best. Good night.